leading surgical oncologist from India, talks about his education and experience. He did his training from the U.S. and Japan and has many publications in national and international journals.
I'm MS trained in surgical oncology from the Tata Memorial Hospital, Mumbai, India. I was trained with Dr. Manjeet Bains, who's a thoracic oncosurgeon at the Memorial Sloan-Kettering Cancer Center, which is located in New York, and it's number 1 or number 2 cancer institution depending on the year in the United States. And also I trained with Dr. Fujita, who's a senior surgeon trained in esophageal malignancies at the Kurume University in Japan, which is near Fukuoka in South Japan. That was my international exposure. I have also presented a lot of papers at international conferences. There are 19 publications in various international and national journals in my name. I was part of various studies, various clinical research. I'm basically interested in minimal access surgical oncology, which is a new and upcoming field. This involves doing cancer surgeries by laparoscopic technique, which means basically by the keyhole kind of techniques, what is commonly in common parlance called as keyhole. So the advantages of this procedure are obvious. Basically there is less pain, less morbidity. There is the long incisions that are associated with cancer surgeries are not there, and the patient has an equivalent result as compared to the conventional techniques that are there. We are particularly interested in colorectal and gynecological malignancies at here, which in doing that by the minimal access technique, which is one of our important areas of development. The second thing that we are interested in is thoracic malignancies, which is operations of the lung and the food pipe, which is the esophagus, which is done. That is also something that we are well trained for. We have had patients from almost all over the globe, so to say. We have had patients coming from the African continent in large numbers, from the Middle East, from as far as Fiji. We have had patients coming from the UK and a few patients coming from the US as well. The infrastructure as compared to any place in the developed world is equivalent. I feel we match the standards, and that goes without saying, because we have JCI accreditation. Now JCI accreditation does make it mandatory for something to be of the same standards everywhere in the world. So I think there is no difference as far as the care, as far as the equipment that is available, whether it is in India or in the US.
Medical Tourism Corporation facilitates affordable medical and dental treatment at world-class international hospitals and clinics. Fill out the estimate request form on our site, medicaltourismco.com, for a free quote and more information.